way to treat superficial veins, and this morning we have the fantastic results of a recent trial we undertook with two very brave Ireland AM viewers, Adrienne Ryan and Mary Fox. We are also joined now by our resident beauty expert, the lovely Laura Birmingham, as well as Dr. Patrick Treacy, who carried out the procedures. Good morning to you one and all.
Good morning.
Especially ladies, because I know you're on here with no makeup. Well done to you both. You're looking fabulous with it. Before I get to you and your fabulous new faces, Laura, this is a really common problem, especially for Irish people. Broken veins on your face and everywhere, but especially on your face.
Yeah, and it's something that we get an awful lot of queries with here into the show, and we get them from men as well. So it's you know, it's not just women. So when I kind of thought to do this earlier in the year, like we started this in April, that was why I went and asked would viewers come and take part in this, and we had a huge reaction to it. Now, particularly, as I sort of said to Patrick as well when we started this, we had to have pictures, and I could not believe within the first 2 hours of us being here on this couch and saying it, the amount of pictures from viewers in my inbox just saying please consider me for this, because people get extremely self-conscious about it and they don't necessarily know what it is that you go and do to get rid of them.
Okay, well, on that note, let's bring Patrick in. Patrick, it is a big problem in Ireland, but it's easily fixable. So what do you do? We hear laser treatment being bandied about an awful lot. What exactly does that entail? How do you treat broken veins on the face?
Well, I suppose the first thing we must look at and say, why is it a big problem in Ireland?
Yeah, what causes it?
Okay, most of it causes because we have very little melanin in our skins. Now, the single biggest cause of it, probably among the Irish, is what we know as the curse of the Celts. The Scottish get it as well, and that is rosacea. The second one is a thing called solar elastosis, and then we have many other ones like scleroderma. And I suppose the reason is that when there's no melanin protection in the skin, the sun induces an enzyme called collagenase. It breaks down collagen, so the superficial vessels in the skin have no supporting network, so they dilate. Now, everybody thinks, okay, this is related to going out and having a glass of wine, or going out and sort of having spicy food, or maybe a change of temperature. These are just triggers, okay? If you have got a situation where the veins are very close to the epithelium rather than being held in the dermis, as soon as you take alcohol is a vasodilator, which means it widens the vessels, and a lot of these people have a lot of problems, particularly in the pub at night time, that start shining bright red.
Okay, so how does the laser fix it? And is it a permanent fix?
Yes, it is a permanent fix.
What does it involve, the treatment?
Okay, well, why is this white and why is this black? That's a good place for starting, okay? This is black because all light is absorbed, it reflects nothing. This is white because it absorbs nothing and it reflects all light. And somewhere in between is all colours. For instance, we know red is red because it absorbs green and reflects red. So we can use this to an extent, very much so in the face. The two chromophores, which means sort of molecules that are coloured, that are targeted by these lasers.
Keep it simple, Patrick. How does the laser stop the veins showing on my face, in very layman's terms?
Okay. Sorry.
Very simply, in one sentence.
Okay. The laser targets the red hemoglobin molecules in the veins and blows them, but it leaves no bruising behind.
So no bruising, it's gone for good and it never comes back.
You'll need 5 or 6 treatments.
Okay.
And after about 5 or 6 years, obviously come back in the sun, you may get vessels back, but they're usually ones in different places.
Fantastic. Sorry to be like that, Patrick, but I need to know the basics. Now, we're going to show some scenes of the laser treatment that Patrick has described in the next few minutes, and be aware that there are there's flashing imagery in the next scene, so if there's children who are light sensitive, or you yourself are, be aware of that. Now, ladies, how are you? Good. Now, Mary, I want to talk to you first, because we're going to look at you. Is it Mary or Adrienne we're looking at first? We'll look at Mary, hopefully. Mary, tell us about why you wrote into us. Were broken veins on your face something you were very conscious of?
I've had broken veins all my life, as far as I can remember. It's hereditary. My mum and my grandmother was the same, and I was just very conscious of it.
Oh gosh, we can see there in the before, yeah. I can't believe, Mary, looking at, and you're sitting in front of me now with no makeup on. What a difference. How many treatments have you had?
It was about 5 or 6.
5 or 6? Yeah. And explain what the treatment feels like to people sitting at home. Is it in any way painful or uncomfortable?
It is uncomfortable. It's like an elastic band kind of hitting off your face.
That's not too bad. It's very fast though. It's very fast.
It is very fast.
Yeah,
it is fast.
And are you pleased with the results?
Definitely.
Did you expect them to be this good?
No.
No. And what do you have to do now to maintain your skin looking like that? Do you have to be careful of the sun, or...?
Well, you don't get much sun in Ireland. I'm not a sun worshipper.
You're not a sun worshipper.
Yeah.
And would you recommend this to women? I'm assuming that you spent a lot of your life covering your face up with concealer and
I would always
foundations.
have makeup on, even in school. I would have worn makeup.
I thought Mary had no broken veins when we arrived filmed in the clinic. I got such a fright, but her makeup was so expertly done from years of just having to put it on for literally just to cover
So
those
did you ever
veins.
imagine you would sit on national TV as
No.
you are this morning with
Never.
no makeup on whatsoever? Look at your skin, Mary, it's glowing. Are you thrilled?
I am delighted.
Okay,
Yeah.
good. I'm glad to hear it. Adrian, I'm going to come on to Adrian very quickly before I come back to you, Patrick. Let's have a look at you beforehand, because again, you're looking fabulous, both of you.
Thank you,
So let's have a
Sinead.
look at your face beforehand. Wow, okay. So it was a big problem for you, Adrian.
Yeah, well, I had one patch there, Sinead, that I was very conscious of.
And would you spend hours covering it up?
Not hours, but
Yeah.
I'd always be conscious that get the side of the face and
And how do you
cover it.
feel now? Now
Oh,
it's
great!
gone.
Absolutely great.
It's literally gone.
Yeah.
It's vanished. It's
I had a lot
amazing
of
the
little
difference.
ones you can see on the screen there.
Yeah,
a lot of little ones.
And how did you feel? How did you find the experience? Was it uncomfortable, or was it kind of, well, it's well worth it?
Well, as Laura said, it's over very quickly. There is a sting when
There
it
is,
happens.
I mean,
but
we can
it's-
avoid
You
that.
look amazing.
It's over in seconds, so
Incredible.
The only reason it's taken this long is there has to be so many weeks between treatments.
Okay.
So that's why we started back in April, we asked.
And Patrick, you were saying that this is a perfect time of year to undergo this type of treatment, when
Yes.
there's minimal sunshine around, because you are using a laser, so it is going to affect the skin.
The lasers get confused and they cannot tell the difference very well between the red molecules of hemoglobin and the brown of melanin. So if we're in a situation where people are back from summer holidays or they have melanin in their skin, you would increase the risk of a problem like burning a patient.
So now is the perfect time to get this done.
Absolutely.
Patrick, I'm assuming people just pick up the phone and call the Esbury Clinic if they want to get the same treatment?
Sure.
How much did it cost,
There's loads
actually?
of information actually on it. On the
How much did it
clinical
cost?
site.
How much would, say, Mary or Adrian's treatment have cost them?
Okay, the first thing is this. Now, the bottom has fallen out of the laser market due to a lot of people bringing in.
Give me a bottom line. We're running out of time, Patrick.
Probably about 50 to 100 euros per treatment.
Per treatment. Well worth it, ladies, would you both say?
Absolutely.
Well, you're looking fabulous, and just in
Thank you,
time for
Sinead.
Christmas. Have a great one, girls.
Thank you.
Patrick, thank you so much. Laura, thank you very much as well. Now, Laura Bergman will, of course, be back with her online Friday beauty clinic, so if you have a question for her, text beauty, followed by your query to 53131, and Laura will have all the answers up on the website at 12 p.m.